The reason why climate and health data, especially that intersection, is integral for sustainable development is because a lot of the way or even the mechanisms of measuring the climate and health like thematic areas has been very siloed over the last few years. And just from a sustainable lens, we're looking at maximizing the impact that any project would have. When it comes to for the future, we are seeing a lot of different things happening on the African continent. Like, for example, in Kenya, just understanding the various drivers throughout the year that cause cholera or even cause like malaria outbreaks or various different environmental triggers that can cause health outbreaks, helps people be prepared. It helps them understand what's happening within their context and be able to actually push for different like allocation of resources within their communities. When it comes to Canon, I think what makes it a very interesting project is that climate and health are very close to people's hearts. First of all, health is something all of us will go through. The thing that Can now does, especially on the country level, is that it brings it closer to home. But how does that reflect country-wise? How does that reflect at the local level where you have a community worker who just wants to understand how does this affect the people who I am working with or the people who I am giving care to? It's also for the fellows to be able to work on these projects. If you don't have, for example, the national statistical system aligned on the work that you need to do, how will you be able to then get, for example, the climate data or the health data that's needed to be able to create some of these models? And when it comes to using what's at hand, our greatest resource as a continent is our people. In Guinea, we have the fellow Abubakar Diallo, who's been working with the Ministry of Health in order to be able to map out the locations of health facilities across the country. He's already mapped out the locations, but for the areas that don't have access or they don't have any health facilities nearby to help, they're actually going to send out mobile clinics as part of the work in the first pilot phase of the next step of the project. We as a global partnership want to ensure that even as climate and health becomes the I would say the narrative du jour, we are part and parcel of the people who are actually making sure that no one is left behind. Inclusion is at the heart of what we're doing, and we're also ensuring that the system stays strong. So individually, climate and health systems stay strong, but also together in that intersection.